Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Forensic pathologists. They perform post-mortem exams or autopsies to determine the cause of death. They study tissues from the body and laboratory results to figure out how someone died.
Sounds like a great job, doesn't it?
Ooh, yeah.
Well, maybe that's why there are less than 500 board-certified forensic pathologists in the country. And one of them is with us, Mayo Clinic forensic pathologist, Dr. Reade Quinton. Welcome back to the program.
Thank you for having me back.
Dr. Quinton, great to see you. So, forensic pathologist, tell us about your training.
So most of us or all of us have to start within the field of pathology.
But you've got an MD degree first.
That is correct.
Okay,
yes.
Then a residency in pathology.
Correct. So
okay.
MD first, then most people do a combination of anatomic and clinical pathology, which is a 4-year residency program. There is some mix and match there. So some people might do like anatomic pathology and neuropathology or anatomic pathology and pediatric pathology.
So what exactly does that mean?
So each one of those is in some ways subspecialties within pathology. Anatomic deals with organ systems, deals with the big things. So for instance, surgical pathology, looking at biopsies, looking at surgical specimens, but it also covers autopsy. The clinical pathology deals with all of the laboratory management, so blood bank, that type of thing. And then within anatomic, there are subspecialties like forensic pathology, but also neuropathology or pediatric pathology, things like that.
That word forensic. Define that for us.
So forensic in the context that we use it in is basically dealing with medical legal cases. Forensic can also be used more on sort of the debate side of things, but for what we use it as, it's implying that we are doing work in a medical legal system.
I'm surprised to hear that there is a shortage because the CSI effect, so to speak. I mean, it sounds like there are so many kids that want to get into studying forensics and because they see it on TV that it's so super cool, but that doesn't translate over into what you do?
Not necessarily. It's the CSI effect is real for sure. And a lot of people become interested at least in science because of that to some degree. It's almost unusual that if you look at television across the board, I would think forensic pathologists are probably the most represented physicians on television, and yet we're a very small community. But yeah, kids get interested in it, and then they oftentimes find out what it takes to get to that point and decide, maybe that's not for me.
So you're talking about 4 years of medical school, 4 years of pathology, then 4 more years?
No. Usually after the 4 years of pathology, it might be, for forensic pathology, it's a 1-year fellowship, if they only do that fellowship.
So 5 years of residency, that's
roughly,
about.
Yes.
You must know this woman. I saw a book recommended, Judy Melanek, since there's only 500 of it.
That's
you
right.
know Judy? She wrote this book, Working Stiff, 2 years, 262 bodies in the making of a medical examiner.
Yes, Judy's actually on the board of the National Association of Medical Examiners with me. So we're both board members. So I see her every year at the meetings, and she's a sweetheart. And the book is, I think, important in that I think every generation there's usually one book that kind of makes people read it and go, ooh, I might be interested in this. And I had, my books at the time that kind of pushed me in that direction. And this is sort of the updated version of that. Her book covers her fellowship. It's just simply during her fellowship, but that fellowship for her happened to occur in New York right around 9/11 and all those events too.
But there's some interesting stories in that book.
Well, put it on your Christmas list.
That's right.
How do you do an autopsy?
Well, it's kind of a complicated question, but in general, there's two big parts of it. There's the external examination and the internal examination. The external examination is categorizing everything from identifying features, so hair color, eye color, tattoos, things like that, to looking at injuries or evidence of natural disease. The internal examination is what everybody thinks of, which is the actual performance of the evisceration, where we remove the organs and look at each organ individually. That tends to take longer, but it depends on the case. So for instance, if it is a homicide with multiple gunshot wounds or multiple injuries, the external actually takes much longer than the internal examination. But those are the two parts. Within that also are ancillary studies. So we may do radiology, we may do extensive toxicology testing or other things.
Toxicology, meaning you're looking for drugs or chemicals,
Correct.
et cetera.
That's correct.
Are there different kinds of autopsies? I mean, you don't do the same kind of autopsy on everybody, right?
No, there are different autopsies. The two main sort of venues, if you will, are the hospital autopsy versus the forensic autopsy or medical legal autopsy. The hospital autopsies are very different in that they are actually made or done at the request of the patient's family. So we approach that family after the patient has died and then explain what the possible benefits of the autopsy are and try to sort of get an idea of what does that patient's family need or what would they like to know.
Yeah, what are the benefits?
Well, a lot of things. In the hospital scenario, we can answer questions about what exactly happened because maybe they're not clear on what the mechanism was of death, but also they may have questions about genetic disorders. Is this something that may affect the rest of my family? Infectious disease. So a lot of different things we may be able to sort of help them walk through at the end.
And doesn't it happen if someone dies alone and there's a question of why the person died? I mean, I know when my dad died, we thought that he had a heart attack, but then we found out that he had had a stroke.
Right. And so those fall into the other category of the medical legal autopsy or the forensic autopsy, where in general terms, I describe those as autopsies that occur when the death is unexpected or unexplained. And there's many subcategories within that. The big difference between the two types of autopsies is that hospital autopsies are consented by the family. So the family basically gives us permission to do that procedure. Whereas forensic cases, we have a mandate by the state to perform those cases. And if the family objects, we have to have a dialogue with them to sort of work out what can we do, what can't we do. But in general, we have to, if we have to do a case, we have to do a case.
Tell us about DNA evidence. It seems like so many people are convicted today based on DNA evidence, which we didn't have a decade ago.
Sure. DNA evidence is interesting. The most common use, honestly, is more for identification purposes than actual convictions like that. So meaning we do get bodies that come into the morgue that are not identified, and sometimes we have to work our way down to the DNA level to try to figure out who is this person that we are performing the autopsy on. As far as convictions go, you're absolutely right. It used to be years ago. I remember being in college and watching the O.J. Simpson trial, and that area was very new at the time, and so a lot of people were sort of questioning, like, well, what does this mean and how can it be used in this case? Nowadays it's used much more commonly, but there are a lot of steps involved, and more often than not it's used to exclude somebody than include them, although sometimes it has been used to include somebody or basically identify a suspect in a case.
So your DNA is unique.
Yes.
Everybody's DNA is different.
Yes, for the most part, yes. Yeah. There are some caveats to that, but yes, for the most part, that is true.
When it comes to children, how do you determine in an autopsy if they died of SIDS or not?
It's a great question because in my previous life, I used to do a lot of teaching on this and sat on the Texas, basically the state child death review, if you will. SIDS is an interesting thing because it's not a diagnosis. We all make it a diagnosis, but it's actually a classification. It originally was created as a terminology to identify a group of infants that died suddenly and unexpectedly during sleep, but nobody knew why. The tricky part about this is that as we identify causes of death, we actually exclude those cases from the SIDS category. So they're no longer SIDS. Over the years, it became sort of morphed in a way into a diagnosis, which is really interesting because when I talk to a family and I'm trying to explain that your infant died of sudden infant death syndrome or sudden unexplained infant death, there's many different categories there or classifications. I'm basically saying we don't know why your infant died. And I think a lot of families, as soon as they hear that terminology, for some reason it gives them comfort because they've heard it on television. They understand, oh, that's a thing, but it's kind of not. So we're trying to re-educate and sort of explain to people today that SIDS is not necessarily a diagnosis, and we're trying to identify what is it that causes it. But the truth is, it's a large constellation of findings. It could be genetic disorders, it could be unsafe sleep environment, or what have you.
So are you telling us that sometimes you do an autopsy on a SIDS patient and it's negative? You don't find anything?
That's the actual definition of a SIDS case, is that after a complete scene investigation and autopsy, the findings are negative.
Explain, or rather encourage someone to become a forensic pathologist. What would you encourage? What would you want to say?
Well, the thing about forensic pathology is that it's new and different every single day. The types of cases you see are not only unique in many ways, but everybody's heard about them. You can watch the news in the morning and go, that's what my job is today. And so other people find it fascinating just because not many people do it.
That's right.
But it is very stimulating from an intellectual level because you are approaching every case as a puzzle. And some of them are very straightforward, and you get into the case and it turns out that the cause of death is exactly what you expected it to be. But my favorite types of cases are the ones where I start going down one road and then in the middle of it suddenly transition to a completely different aspect of the case and end up, a cardiac case may end up being a neuropathology case or something like that as you go.
A brain case instead of a heart case. So tell us about one of your most interesting cases.
It's interesting. A lot of people ask that, and some of them I can't really discuss that much too because they may still be going through trial or whatever. But again, I love the cases where something just incredibly odd or unique happened that maybe we didn't know about until we did the autopsy, which really speaks to the value of the autopsy. And one of the cases I did, which was honestly, I believe it was during my fellowship year, I actually had two skydiving accidents, separate cases. I don't think anyone else in my office in the 14 years since then ever saw a skydiving case, but I saw two of them. But
parachute didn't open, or
well, that was the question. One of them, the people on the ground observed that the parachute deployed, and the person on the parachute just never moved again, and he just slowly drifted to the ground and didn't catch himself, just landed on the ground, and they all rushed over, and he was essentially dead at the scene. So we didn't know what was going on. Well, it turned out that we brought in the FAA. He still had all of his gear on him. He had his parachute still on his person when we received the case. And it turned out that his parachute had not been packed properly. So parachutes tend to incrementally deploy. They don't just burst open. If you watch video of them, they sort of puff out a little bit at a time. His was packed in such a way that the entire parachute just immediately opened all at one time. When it did, it tore his aorta in 3 places. So he actually died from an aortic dissection or transection, I should say.
And that's the big artery that comes
so,
right out of your heart. Oh,
right. So the force of that impact, basically, of the deployment, tore his aorta, and then he just drifted to the ground. He was already dead.
Mystery solved.
Yep, you figured it out. Forensic pathologists, their job is to figure out how someone died based on autopsy and laboratory results. It's a fascinating job, and I think if you're willing to go through all of the training, let's see, it's 4 years of medical school, 4 years of residency, another year of specialized training, I think for sure you can get a job.
That is true.
Our thanks to Mayo Clinic forensic pathologist Dr. Reade Quinton. Thanks for being here this week.
Thank you so much.